a moment, First Minister. Thank you.
Thank you, Presiding Officer. I will report today on the current and, at this stage, much more positive course of the pandemic. I will explain why, although significant pressures and uncertainties do remain, the latest data nevertheless gives us confidence that we have turned the corner on the Omicron wave. I will then confirm our next steps in lifting the protective measures introduced before Christmas. I will also indicate what we can all continue to do in the immediate period ahead to keep cases on a downward trend and reduce the pressure on the NHS and the wider economy. And finally, I will provide a further update on the vaccination programme. First, though, today's statistics show that 7,752 positive cases were reported yesterday through both PCR and lateral flow tests. 1,546 people are currently in hospital with COVID. That is 21 fewer than yesterday. 59 people are currently in intensive care, including 17 who have been in ICU for more than 28 days, and that's one more than yesterday. Sadly, though, a further 31 deaths have been reported, which takes the total number of deaths under the daily definition to 10,093. And once again, I send my condolences to everyone who is mourning a loved one. As we can see from the data, Omicron is continuing to infect large numbers of people here in Scotland, across the UK and indeed in many other countries around the world. Hospital admissions and overall hospital occupancy associated with COVID also remain high. However, notwithstanding the very real challenges COVID continues to present, the evidence I set out last week suggesting that the situation was beginning to improve has significantly strengthened over the past 7 days. A combination of booster vaccinations, the willingness of the public to adapt their behaviour to help stem transmission and the temporary protective measures introduced in December has helped blunt the impact of the Omicron wave. Last week I said that the data indicated cases were falling across most age groups, and I can report today that this trend has continued. Now, there still needs to be some caution applied in interpreting case data at this stage, given the recent changes to guidance on PCR and lateral flow testing. However, data for the past 13 days, taking account of both PCR and lateral flow tests, shows a significant fall in the number of new positive cases. And to put some detail on that, on Sunday, Monday and Tuesday of last week, 36,526 new positive cases were recorded through PCR and lateral flow tests. This week, over Sunday, Monday and today, Tuesday, 20,268 cases have been reported, so quite a significant drop. And if we look just at PCR tests, although I would ask everybody to bear in mind the limitations now in doing so, we have seen cases fall from an average of almost 13,000 a day to just over 4,600. That's a decline of 64%, and cases have fallen across all age groups. Test positivity in PCR tests has also declined from almost 30% in early January to under 20% now. The most recent Office of National Statistics data, which covers the week to the 7th of January, and so it does have a time lag associated with it, reinforces this more stable and positive assessment. It indicated that the number of people with COVID in that week, around 1 in 20, was broadly the same as in the previous week. So taking all of this into account and triangulating the various sources of data allows us to say with some confidence that the rise in cases driven by Omicron peaked in the first week of January, and that we are now on the downward slope of this wave of cases. This assessment is also reflected in the data on hospital admissions, hospital occupancy. The number of patients in hospital at any given time with COVID is higher than it was 7 days ago, increasing from 1,479 to 1,546 today. However, the increase of 67 is significantly smaller than it was in the previous 7 days. And encouragingly, admissions to hospital of people with COVID, though still too high, are nevertheless now actually falling. In the week to 7th January, 1,040 were admitted. In the week to 14th January, that was down to 960. The number of people in ICU, which this time last week was rising, has also now fallen slightly over the past 7 days from 65 to 59. So all of this is very positive news, and it comes as an enormous relief, I am sure, to all of us. Of course, we do need to recognise that there are still some uncertainties ahead, and so throwing all caution to the wind at this stage would be a mistake. For example, the full impact of the return to work and school after the festive break won't be apparent yet in the data, so it is possible that we will see case numbers tick up again in the next couple of weeks. Also, just as the introduction of some protective measures may have helped slow down transmission, it stands to reason that the lifting of these measures could have the opposite effect. Indeed, that is exactly why it makes sense to lift measures on a phased basis. And lastly, although cases are now falling, the NHS remains under acute pressure, and staff absences are still causing some disruption across the economy and our critical services. So while we can take great heart from the latest data, we know from experience how important it is to be responsible and appropriately cautious in the face of this virus. And that is the context then for the decisions that Cabinet reached this morning. Yesterday, of course, the limit on attendances at outdoor public events was lifted. The remaining statutory measures introduced in response to Omicron are as follows: limits on attendance at indoor public events, the requirement for 1 metre physical distancing between different groups in indoor public places, the requirement for table service in hospitality premises serving alcohol on the premises, and the closure of nightclubs. Given the improving situation, and as I said last week, we hoped to be able to do, I can confirm today that all of these measures will be lifted from next Monday, 24th January. We will also, from Monday, remove the guidance advising adults against non-professional indoor contact sports so that these can resume as normal. And from Monday, we will also lift the guidance asking people to stick to a 3-household limit on indoor gatherings. However, it is important, I think, to stress this point. Notwithstanding the improving situation, the level of COVID infection circulating in the community is still high. So to minimise the risk of getting the virus, it would be sensible for all of us to remain cautious in our social interactions at this stage. Even though from Monday we will no longer recommend a fixed upper limit on numbers of households, if we all continue to keep gatherings as small as our circumstances allow for now, I would suggest until the end of this month, we will reduce our chances of getting infected. And of course, we should continue to take lateral flow tests before meeting up with people from other households. Please also remember to record test results, whether positive or negative, through the UK Government website. Let me stress this is even more important now that we are no longer advising confirmatory PCR tests for those without symptoms who test positive through lateral flow devices. Recording these results ensures that we are able to make better assessments of the trends in infection. Finally, Presiding Officer, we will continue to ask people to work from home whenever possible at this stage and for employers to facilitate this. However, we will engage with business now about a return to a more hybrid approach from the start of February. The baseline mitigation measures that were in place before Omicron and the requirement for businesses, service providers and places of worship to take reasonable measures to minimise the spread of COVID on their premises will be retained at this stage to help keep COVID contained as this wave recedes. That means face coverings should still be worn, must still be worn in public indoor settings and on public transport. Businesses and other organisations should continue to have regard to guidance and take reasonable steps to minimise the spread of COVID. And hospitality premises should continue to collect contact details for customers, which is, of course, important for the effective operation of Test and Protect. In addition, the COVID certification scheme will continue to apply for now to large indoor and outdoor events and to late-night venues, all settings where transmission risks can be higher. As of yesterday, guidance stipulates that organisers of events with 1,000 or more in attendance should check the certification status of at least 50% of attendees or 1,000 people, whichever is higher. Now, I indicated last week the Cabinet would consider and decide today whether or not to extend the certification scheme to other premises, such as licensed hospitality venues. This was undoubtedly the most difficult decision we faced this morning, and yet again, the judgment we have arrived at was finely balanced. On the one hand, extending COVID certification could offer public health benefits, ensuring that people attending certain venues are vaccinated or tested. It reduces to some extent the risks of transmission and also the risk of serious illness should an individual contract the virus in one of these settings. On the other hand, we understand that extending certification could create additional costs for businesses at an already very challenging time. And of course, the smaller the business, the more difficult these costs can be to bear. So the task for Cabinet today was to weigh these considerations and decide what, in the current circumstances, would be proportionate. Given that cases are now falling quite rapidly and the current wave is receding, we decided that we will not, at this stage, extend the COVID certification scheme to other premises. We will, of course, reconsider this should circumstances and therefore the balance of judgment change in any significant way. If cases were to start to rise very sharply again, extension of certification may well be a more proportionate alternative to other more restrictive measures. However, our conclusion today, given the improving situation, is that extending certification would not be proportionate at this stage. There is, though, one reasonably minor change to the certification regulations that we will propose. At the moment, nightclubs and other late-night venues must apply the scheme if they have in use a designated area for dancing. We intend to amend the definition here to provide greater clarity and prevent premises from avoiding certification simply by having tables on a dance floor and therefore claiming it's not a dance floor, but nevertheless permitting dancing to take place. This change will take effect from Monday, when late-night venues are able to reopen. Finally, Presiding Officer, let me say a few words about the updated rules on self-isolation after a positive COVID test. These rules, confirmed 2 weeks ago, remain in place. If you test positive, you will be advised to self-isolate for 10 days. However, if you don't have a fever and you take 2 negative lateral flow tests more than 24 hours apart on day 6 and day 7, you can end self-isolation on day 7. Last week, the UK Government announced further changes to self-isolation for England. This was publicised as allowing people to end self-isolation after day 5. Essentially, however, this change simply brings England's rules into line with those already in force in Scotland. This is because in Scotland, we count the day of a positive test as day 1 of isolation. In England, this is counted as day 0. In addition, in England, you can end self-isolation after day 5. In Scotland, you can end it on day 7. So the slightly different ways of defining the beginning and the end of the self-isolation period has given the impression of difference. But the substance, the period people are actually required to self-isolate for, is in fact the same in Scotland and in England. And I think it's important that people are clear about that. Presiding Officer, the lifting from Monday of the protections introduced in response to Omicron is possible in part because of the efforts everyone has made voluntarily and as a result of guidance and statutory measures to help stem transmission. And I want to put on record again today my thanks to people across the country. But it is also, of course, down to the success of vaccines. At this stage of the vaccination programme, we continue to offer boosters and also to implement the latest advice from the JCVI. Just before Christmas, the JCVI recommended that booster jags should be offered to 16 and 17-year-olds 12 weeks after their second jags. So any 16 or 17-year-old who had a second jag 12 weeks or more ago, or who is just approaching that point, can now book a booster appointment online through NHS Inform. They can also turn up at a drop-in centre and get a booster there. In addition, second doses of the vaccine are now available for 12 to 15-year-olds who had a first dose at least 12 weeks previously. Again, appointments can be booked online. Alternatively, young people can choose to go to a drop-in centre, and parents and carers are, of course, welcome to attend with them. So far, the JCVI has recommended that booster jags should be offered only to those 12 to 15-year-olds at particular clinical risk from COVID. Any 12 to 15-year-old in that position will receive a letter inviting them for a booster 12 weeks after their last primary dose. There is no need to book an appointment. And finally, 5 to 11-year-olds with specific medical conditions that put them at greater risk from COVID will be invited for their first vaccination from this week onwards. Again, let me stress, they will be contacted directly. There is no need for them, or more appropriately, their parents or carers, to book online. In due course, 5 to 11-year-olds who are household contacts of people with immune suppression will also be invited to receive vaccination. And of course, we stand ready to quickly implement any updated advice from the JCVI about vaccinating all 5 to 11-year-olds. There are good reasons why the JCVI has given different advice for different age groups, but I realise it can be confusing. So the NHS Inform website now has a self-help guide for parents, carers and children, setting out what young people need to do to get vaccinated and when they can do it. If you can't get online, you can also get this information by phoning the vaccination hotline on 0800 030 8013. That's 0800 030 8013. Now, the final point I want to make relates to vaccinations for adults. Scotland has achieved very high rates of vaccination. We are the most vaccinated part of the UK in terms of first, second, third and booster doses. But there are still more than 600,000 people over the age of 18 who are eligible for a booster but haven't yet had it. And there are hundreds of thousands more who have not yet had a first or second dose. So I would encourage anyone who falls into one of these categories to make an appointment as soon as possible or go to a drop-in clinic. There is plenty of capacity and you will be made welcome. The latest available data adjusted for age shows that someone not fully vaccinated is at least 4 times more likely to require hospital treatment than someone who has had a booster or third dose. And although being fully vaccinated doesn't eradicate the risk for any of us of getting COVID, it does reduce that risk, and therefore it also reduces the risk of us passing it on to others. If you choose, therefore, without good reason, not to be fully vaccinated, you are putting your own and others' lives at unnecessary risk. So if you haven't had a booster or third jab yet, please come forward as soon as possible. And if you haven't had a first or second dose yet, please do so without delay. It is never too late to get the COVID vaccines and to start getting the protection that these vaccines do offer. Presiding Officer, the situation we face today is undoubtedly less severe and much more positive than it might otherwise have been without the sacrifices everyone has made over these past few weeks. Despite what people may be hearing from media commentary, though, we have not yet moved from the epidemic to the endemic phase of COVID, although I do hope that transition is underway. However, we are, I hope, once again entering a much calmer phase of the epidemic. That then allows us to consider the adaptations we might need to make to build our resilience and manage this virus in a less restrictive way in future as we do move into an endemic phase. We have, as I've indicated in previous weeks, started work now on an updated strategic framework, and we will be consulting on this over coming weeks. All of this, therefore, gives us much cause for renewed optimism. That said, we are still in a challenging position. The NHS does remain under very significant pressure. Indeed, as is reflected in today's A&E waiting time figures, the past couple of weeks have probably been the most difficult the NHS has ever faced, as COVID-related staff absences have compounded the other pressures it is dealing with. The number of COVID cases across Scotland, although declining, also remain high. And because Omicron is so infectious, there is still a significant risk attached to social meetings and interactions. That is why, although we can be increasingly optimistic at this stage, we must all still play our part in helping further slow the spread of the virus. So I'll close by highlighting again the steps we can all take to help do that. Firstly, as I've just talked about at length, please do get fully vaccinated if you haven't already. Second, take care when socialising. Until Monday, keep indoor gatherings to a maximum of 3 households. And after that, I'd suggest for the rest of this month, try to keep them as small as your circumstances allow. And test before you go every time. And lastly, please take all the other precautions that we know make a difference. Keep windows open if meeting indoors. Continue to work from home for now if you can. Wear a face covering on public transport, in shops and when moving about in hospitality, and follow all advice on hygiene. These measures do make a difference. The fact that so many people have stuck with them has helped make it possible to lift the protective measures put in place before Christmas. So if we continue to stick with them, we can all continue to do our bit to keep each other safe, protect the NHS and keep us firmly on the path, even if only metaphorically speaking, to a much sunnier spring and summer.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 40 minutes for questions, after which we'll move on to the next item of business. And I'd be grateful if members who wish to ask a question were to press the request to speak buttons now or enter R in the chat function. And I call Sandesh Kulhani.
Thank you, Presiding Officer. And let me begin by urging everyone to keep getting vaccinated. Even if you have so far been against the vaccine, there is still time to change your mind and get your first jab. The First Minister's statement begins a sea change in the government's policy, starting to shift from a rules-based approach more towards trusting the Scottish public, as we were pushing for. Yesterday, we called for an end to all business restrictions, an end to guidance on household mixing and social distancing, and an end to the ban on indoor sports. We did so because the data shows that we are past the peak of Omicron. At this stage, protecting mental health, physical health, and Scottish jobs is every bit as important as slowing the spread of COVID. Most of what we've called for has been met, but the government still hasn't gone far enough in two key areas. Firstly, we welcome the move away from guidance on working from home, but can the First Minister explain the evidence behind that decision? Why at this stage can we not go further? Perhaps publish all the evidence used to make this decision. And secondly, it's right that the First Minister has backed down on extending the vaccine passport scheme. For many Scottish businesses, it remains a burden and a potential risk. The First Minister has twice threatened to extend the scheme to Scottish businesses. Twice she's backed down. Isn't it about time the First Minister accepted that this scheme is a dud and scrapped it altogether? Finally, while we are past the peak of the Omicron crisis, we are at the peak of the crisis in A&E departments. The latest appalling A&E figures show the worst ever waiting times for patients. Double the number of patients were waiting more than the target time compared to the same week last year. My colleagues on the front line of the NHS are overwhelmed. COVID is making things worse, but the root of the problem is not Omicron. It's the lack of a credible plan from Humza Yousaf. How many wake-up calls does the Health Secretary need before he finally devises a coherent strategy to tackle the unacceptable emergency waiting times in Scotland?
First Minister.
Thank you, Presiding Officer. The government policy and approaches to tackling COVID has, throughout these past 2 years, and will continue to adapt in line with changes in the path of the virus. Keeping the public as safe as possible will continue to be our driving imperative. The approach that we have taken, is balanced, it is appropriately and suitably cautious, and it is data-driven. And for all these reasons, it stands in stark contrast to the approach that the Conservatives have proposed at each and every stage. And I would gently remind the Chamber and indeed the public again today that at every turn, whenever decisions have been taken, the Conservatives have, in my view, rather opportunistically opposed whatever it has been that the Scottish Government had recommended. That's been the case on face coverings, it has been the case on working from home, it has been the case in terms of mitigations in our schools. So with the greatest of respect, when the Conservatives have called it wrong at every key juncture in the tackling of this virus, forgive me if I continue to follow clinical advice and take careful judgments rather than follow the advice that the member is offering today. On the two specific issues, firstly on working from home, I continue to be really surprised that Dr Gohani asks me for evidence of things that I think even non-clinically qualified people now see as pretty obvious. When you're coming out of a wave of this virus, the worst thing to do is to lift all restrictions at exactly the same time and allow all of the mixing and interactions that we have been trying to restrict to happen again all at once. And therefore, what is the evidence of saying that if people are not working from home, not travelling to get to work, not coming together in canteens, for example, at lunchtime, is because when we reduce that kind of interaction, we reduce the opportunities for the virus to spread. And while we are lifting other restrictions, for a couple of weeks longer, it is prudent to keep that piece of guidance in place. So it's common sense, I would argue, and I think most people across the country understand that. Secondly, on accident and emergency, in passing, going back to my earlier point, I would simply say, had we followed the advice, if I can give it that polite term, of the Conservatives and lifted measures prematurely at previous stages, not had in place the mitigations that we have in place, we'd be in a much worse position with COVID than we are right now. And the pressure on our National Health Service and accident and emergency departments would be even greater than it is right now. We continue to support our National Health Service. The figures for A&E today reflect probably the most difficult period in the history of the National Health Service over the past couple of weeks, when staff absences have compounded the other pressures. I would hope we'll see these figures start to improve in the weeks ahead. We'll continue to support the National Health Service in every way we can, but the biggest thing, the most important thing all of us can do to support the National Health Service right now is continue to act in the careful way we have been doing to keep cases on that downward trajectory.